Directors this past May. Last year in October, we began a year-long strategic planning process for the AMAA Alliance with a professional outside facilitator. It was a year of reevaluation and of strategic thinking and planning. We developed a strategic plan that will be asking us to look at the services we provide in a new, but yet still old way. Thriving as an alliance in the 21st century is a lot like thriving as a medical family in the 21st century. Organizations also have unique stresses, just like we face in the medical family. And some of these are unanticipated and unavoidable. But it's how we face these challenges and the stresses that allow us to thrive. The way we were yesterday must evolve into the way we are today and will be tomorrow. Change is always a challenge. It's sometimes messy. It sometimes can be painful as we are asked to step outside our comfort zones, both individually and as an organization. But change is also an opportunity to reinvigorate, to reassess how we are going to use our resources, and to reunite with a common vision and a passion to impact the lives of every physician family in a positive way. We know as Alliance leaders, we must continually work to understand the changes necessary to make sure that our programs and resources reflect the needs of our current and the needs of our future members. Once we recognize that we need to change, there is one more vital component that we must all share at every level: the courage to take the risks that are necessary to make the changes. Now, last June, Nancy, in her inaugural address, shared her story of meeting famed anthropologist Margaret Mead when she was just 17 years old. And it wasn't until years later she realized who she was and the impact of what this woman had to share with her. And the quote that reminds us of what this organization stands for, the AMAA Alliance: "Never doubt that a group of concerned citizens can change the world. Indeed, it is the only thing that has." I know that you have changed the world in which you live, whether it's your own world, that of your spouse, a patient, your children, a school, your community. That is why I know the AMAA Alliance leadership and at every level possesses the courage and conviction we need to take the steps necessary to ensure that the Alliance is around to provide resources for the 22nd century medical family. We know that the medical families are changing as the face of medicine changes. Some statistics for you. Our members are changing, and potential members reflecting medicine's changing new face. Many of you already know that 50% of medical students are women. 50% of the women physicians are married to another physician. 80% of their spouses hold equivalent graduate degrees. We also know that approximately 62% of physician spouses work outside the home. Our alliance not only has a gender gap, but we also have a generational gap. We must find avenues of involvement in our organization to all those who are committed to caring for a physician and willing to serve as their passionate advocate in today's challenging times for Americans' physicians. Your National Alliance leaders also believe that we can only thrive as a national organization with a renewed recognition that service to our grassroots members is our most important task. And that is why when Kathy invited Nancy, she was really excited because she really wants to come to county meetings. She emphasized counties outside her own. You know, as a state president, I often went to as a state president, you know, you travel, you go to all your different counties and kind of get a feel for what everyone is doing. And because my husband and I have had the privilege of living in 4 different states, I've been involved in a lot of different counties and got to sense the culture. You know, every county's unique, every county's special. So she jumped at the chance to be able to come and be a part of this, and she has challenged all the board members to attend county member meetings that are outside their home county. The AMAA Alliance must meet the needs of our members in our counties and state alliances and be relevant. We're grateful to every alliance member and leader who came before us, and we celebrate their vision and passion that enabled our alliance to serve for these past 88 years. And we are hoping that the new strategic plan honors them by building on their success with our renewed commitment to support our members. Strategically, this is where the work starts. we are going to focus our resources inward first, to enable us to first take care of our own families, and in turn, that will make us stronger and more able to reach out to others in the communities. I know this is important because we only have to look at the friendly skies. Whenever we fly, they always tell you that in case the oxygen masks drop down first, you take care of yourself first, put the mask on yourself first, and then you can help others. So here is what we are focusing on for our membership. News and information affecting the family of medicine today. Go on the website to download. There are podcasts from this past LDC, and those of you that were at LDC know how excellent the speakers were and all the good things that happened there. There are photos, PowerPoints, programs to help you use in your own county, and much more. There's the Alliance Connections magazine that comes out every quarter that hopefully everyone is getting and taking a peek at. And then there's eConnections that comes out each month for those email addresses that we all need. Physician wellness, resource kits, and tracking tools to measure progress will help you move your physician spouse to the front of the line with facts and handouts that he or she can also use to educate patients. The AMA's program, Healthy Life Steps. There's work-life balance information. You know, some of us aren't quite as concerned about the work-life balance as much. We're kind of hopefully heading off to that less work, more life balance. But there's tips and resources that you can use today and share with friends and colleagues in your hometown and across the nation who are experiencing trouble. There's ideas, advice, a chance to talk with fellow members. We are now on Facebook. So, for those, how many of you are on Facebook? Come on, no, just a few. Okay, we've got a few Facebook people here. Okay, but we're on Facebook. We have an Alliance blog. We have a Young Members Connection blog, so we have various ways we're trying to connect people all across the country. There are resources. Resources can be tailored to our members at their own particular life stage in the medicine family. Whether you're just starting in a medical family, in medical school, or getting ready to retire. What you need when you need it. Then there's our wonderful website. It's been updated, it's been improved, so please, www.AMAalliance.org. Please check it out for those of you that are on the internet. We provide our members a nationwide voice in support of the medical community's health advocacy efforts from the convenience of your home and office. We also need to communicate more and effectively with each other on every alliance level and work together to train and inspire new leaders. But please know, we are not abandoning those things that we have known and loved. Health promotion, advocacy, and fundraising for medicine's future. But we will look hard at how we promote and assist in these activities to achieve even greater results. Now, she asks us that I hope you consider joining us in Chicago in June, next June. Be part of the discussion and decision-making process. If you can't join us in person, please visit our website and join us via technology. By your participation in the AMA Alliance, not only will you help the Alliance to strengthen all those who advocate for America's physicians, but you'll help the Alliance to position itself to become the volunteer voice for healthy families, whether it's our own or those in our communities. Thank you for giving me this opportunity to spend time with you this meeting and to share with you why I am so excited about our future together. Remember that coming together was the beginning. Keeping together is progress. Working together to ensure a brighter future for medicine and our medical family is a success. And I will now open the floor to any questions.